Welcome back to our COVID-19 special report as we answer your questions about this pandemic. And we should mention that we are fielding lots of questions right now live on our Facebook page. Keep them coming. We appreciate it. This next question is for our Secretary of Health. Ivor asked, some people are sewing homemade masks. What is the recommendation on these? Are they effective?
Well, certainly that's not the ideal. We do know that there's national issues with the supply chain for masks, but I would also like to make sure that individuals know that general public use of masks is not recommended. We need to reserve mask use for our healthcare workforce and for people that are ill. Please don't go and buy masks if you don't fall into those categories. We really need to save that supply chain for the folks that are going to need it. Back to the question of, is a homemade mask acceptable? There are some jurisdictions where they don't have access to, medical supplies, and so they are having to improvise. But again, general public use of masks is not recommended at this time.
All right, thank you. Well, this next question is for Dr. Settle. How long can the coronavirus live on surfaces like at the grocery store or on the human skin? Doctor?
Yeah, that's a great question. I've gotten that one before. We don't entirely know everything about this virus, but we're learning more every day. And some early studies have shown that the virus can last on surfaces anywhere from a few hours to 2 to 3 days. That being said, it's variable on the different surfaces, and simple cleaning can take care of that. So you don't need any special material or special cleaning supplies to clean off surfaces. And most likely the transmission of the virus from person to person isn't by touching surfaces, but more by being in close contact with that individual for an extended period of time.
And Dr. Erickson, give us your take on this and how this virus spreads.
Yes, I think that's quite an interesting question. I've seen a lot of varied responses to that too. Recently I saw a virologist talk about anywhere from a couple hours to 9 days, but I think, Dr. Settle, you're closer there with a day or two. And certainly it emphasizes the fact we need to clean surfaces, clean our devices. I know we're going through areas 2-3 times a day and doing phones and iPads and keyboards, so it's very, very critical to clean those surfaces and keep everything clean.
Okay, well, this next question is for everyone. So Peggy asked, do our hospitals have enough masks and ventilators to care for South Dakota residents who become seriously ill with the virus? And how do the hospitals obtain those supplies? Let's start with the health secretary.
Sure. That's a great question, and one that we're working on every day to assess the status of hospital capacity in our state. We work very closely and have great cooperation with the providers across our state, and I'm really grateful for that. Hospitals obviously order supplies on their own. They have their own supply chains, and they're accessing those, every single day. In addition, when we have providers, including hospitals or other healthcare providers who need supplies, who can't get them through the regular supply chains, they can ask the state for access to some of the supplies that we have available. We have a process for that. It's relatively easy to use, and we can get masks and other supplies out to providers.
Dr. Erickson, what about Avera supplies? Can you tell us more about your hospital chain?
Well, I think it depends, really, when you look at the response. If we stay home and practice social distancing, I think it'll certainly help. Dr. Anthony Fauci, he's talked about everything we do before a pandemic will seem alarmist, and everything we do after a pandemic will seem inadequate. And he would argue that we're really behind where you think you are, and that we need to flatten the curve. So if you consider this virus starts slow and kind of goes along, and we're just getting to that phase where it's really taken off, people are concerned about the surge, so it'd really take off and peak. And if your capacity is at a certain level and you hit that surge and you exceed your capacity, that's where we'll run into the challenges and we may not have enough supplies. So if I have 100 cases and they all show up on one day, I'm challenged. But if I see 10 cases a day and spread that over 10 days, much easier to control. So it really depends, and we can't emphasize enough how important it is to stay at home, practice social distancing.
Yeah, Dr. Settle, how is Hanford doing with supplies at the hospital?
You know, supplies are our top priority. We need that personal protective equipment, or PPE, to keep our staff safe so that they don't contract the virus when they're taking care of these patients. And I can't thank those staff enough, and all of the healthcare personnel across the state that are really going out there and doing the work, taking care of these patients in their time of need. That personal protective equipment, we're monitoring daily, and we've been monitoring since January, stocking up, making sure that we have enough to do what we need. We've also been modeling and anticipating what are those volumes going to look like? What is that potential worst case scenario, so that we can be as prepared as we can for that. So I think we're looking every day at what our supplies are. We're doing lots of great conservation efforts in our hospitals and in our clinics, and looking at different ways to deliver care. Can we use telemedicine so we don't need to use PPE all the time? So we're doing anything and everything we can to make sure we have adequate supplies for our staff.
All right, thank you.
That topic. It's a very important thing. Governor Noem's executive order today discussed elective procedures, and not doing elective procedures so that we can preserve the supplies that we have is very, very important moving forward. And so that was one of the directives in her executive order, and it's going to help us with our supplies moving forward.
Perfect. Our next question again is for the secretary. We just had this one come in from a delivery driver. We all know how important they are right now. He's wondering, I go from city to city, business to business. Can I get a test to make sure I'm not spreading COVID-19? I don't feel sick, but I want to make sure I'm not carrying unknowingly this virus to people around the community.
Right. So right now and into the future, we are not testing people that do not have symptoms. If people are concerned, they need to practice good hygiene, social distancing. If they are ill, they need to stay home and call their provider and see if they need to be tested.
Well, this one just came into our newsroom as well. Any advice for people who actually have to go out and work despite the government's recommendations? What advice do you give?
Sure. Well, again, the governor's executive order today outlined several strategies that she's asking all businesses in the state to take. And so that's the baseline for businesses across the state on what they can do to help their workers stay safe. So they can implement things like telework. They can help their workers practice social distancing by moving things around. They can help with environmental disinfecting and cleaning, and giving staff the opportunity to practice personal hygiene. So there's a lot of things that businesses can do. For those businesses that are doing things where you might see large groups of customers, she's asking them to limit, and she's asking them to take good common sense action so that we can get ahead of this. So that means not having more than 10 people in your establishment. If you serve meals or you're a bar or a casino, you need to do business differently so that we can stop the spread.
Thank you, Secretary. Now for our healthcare providers here, we have a question. Being a type 1 diabetic, am I more prone to the coronavirus? Talk about diabetics, others in the community who might be more prone to this virus. Start with Dr. Settle.
Sure. So individuals with type 1 diabetes certainly could have an immune system that isn't as strong as an individual who doesn't have type 1 diabetes. And that would put them more at risk for any types of infections. They would be an individual that would recommended to have other vaccines other than the usual influenza vaccines that we all get every year. So those individuals would be in that higher risk category, along with others that have chronic conditions, in addition to those that are 60 and older. So those individuals, we really need them to stay home and avoid contact with individuals that are out and about more, or those younger populations. And look out for your neighbors that are in those subgroups, either with those chronic conditions or that are the elderly. What could you do for them to help them out so they can stay home and yet still get the groceries they might need, or get a phone call so that they're not feeling so isolated?
Dr. Erickson, would you like to weigh in on this as well?
Yes, I agree that certainly those with diabetes, hypertension, heart disease, lung disease are at high risk, and those of us over 60. A few things I'd suggest is get plenty of rest, exercise, and if you smoke, I would highly recommend you quit smoking.
Okay, thank you. Another question just came into our newsroom. What if your child has a chemotherapy treatment at Hanford Children's Hospital? What should they be doing?
So individuals undergoing chemotherapy are going to be in that at-risk category as well because their immune system will be down. So those individuals will need to practice very careful social isolation after their chemotherapy when their immune system goes down, and avoid any contact with others. And that's usually the case after chemotherapy anyways, that you really want to minimize that contact so that you minimize getting any infection.
All right, thank you for that. And now's a question on everyone's mind. People saying, I have a cough, my throat has hurt for a little while. Should I get tested? What should I do? Let's start with the secretary and hear from everyone quick.
Well, first and foremost, you should stay home, you should stay away from other people, and you should call your provider. Don't go to the emergency room, don't go into the clinic. We don't want you infecting other people, no matter what you're dealing with. So please take those steps to keep yourself as healthy as possible and not spread it to others.
Dr. Suttle?
I agree. We need to have you stay home. But if you're concerned, we want you to either call in or do an e-visit. What will happen when you call in is there will be a nurse on the other end of the line to ask you some questions and ask about travel, ask about what your symptoms are, how long you've experienced them, if you've had any exposure to another person that might have had COVID. And that helps us really determine, should you be tested? So we need to kind of go through that and talk with you about what's going on, what are your symptoms, what have your patterns been with travel and exposure to others, and that's going to help us know. So we don't want you to be concerned. So if you're worried that you might have it, please call rather than come in so we can talk to you, ask you some questions, and find out if you need to get tested.
Thank you for that. Well, we have to take a quick break now, but we'll be right back with our COVID-19 special in just a moment.